Hey everybody, welcome back to One Bypass, One Stroke, One Survivor with my dad, Bill Daly. Today we're going to talk about the types of strokes. There's three types, and we're going to talk about what causes them and how they're treated. So,
Well, before we start, I would like to say that, and I apologize if you guys feel that way, that Scott has critiqued my performances so far by saying that he thinks I've been too uptight,
a little bit.
not showing any charisma or personality. And we discussed it, and we came to a conclusion. He gave me a box of Dukalax.
And he didn't know he's relaxed.
And I actually feel so much better, and you should notice
That hunk of cola up his ass is gone now.
in my personality.
Okay. All right, now we're free to really enjoy the charisma that is.
Okay.
All right. So, like I said, we're going to talk about the different types of strokes, what causes them, and I'm still stuck on the goalies and the treatments for them. So let's dive right in. What are the three types of strokes, Ted?
Three types of stroke are ischemic. That's ISCHEMIC. I'm spelling it out because there will be a quiz at the end of this session. Ischemic stroke. Then there are hemorrhagic strokes, and don't ask me to spell that. And finally, actually, the third one doesn't turn out to be, in the future it may, but it's called a TIA, Transient Ischemic Attack. Those are the three that are focused on.
And which one happens the most around the world? Which kind of stroke do people experience the most?
The ischemic stroke is very prevalent.
What percentage of the time?
85% of strokes are caused by an ischemic stroke.
And what percentage of the time are the other two?
Hemorrhagic is 13%, although much more fatal than ischemic strokes. And the TIAs...
A much smaller percentage of it.
Well, actually... It's tough to say. Ischemic strokes basically masquerade.
No, you mean TIA.
You're right. I'm sorry. TIAs actually masquerade as the real deal. Although within 5 minutes after the symptoms, up to 5 hours, maybe even longer sometimes, the symptoms will disappear, and it's like it never happened
and
before.
Hence the word transient, I guess.
Right. Although down the road, anyone who has suffered a transient TIA or as you might call it, a mini stroke, are much more susceptible to a real stroke down the road.
What kind of stroke did you have?
I had a hemorrhagic stroke.
That's the more deadly of them.
That's the more deadly. I had a left side hemorrhagic stroke, which affected my right side. The brain itself there are two hemispheres in the brain. If you have a stroke, as I had on the left-hand side, it will affect the right-hand side of your body. If you have a stroke on the right-hand side of your brain, it will affect the left-hand side of your body.
And so let's talk. Okay, so those are the three types of strokes, although one really doesn't qualify as a stroke. It only behaves as a stroke.
Right, exactly.
Or what did you use? The word masquerade. Masquerade. So let's stay with ischemic stroke. So what causes an ischemic stroke?
Usually ischemic strokes are caused by blood clots or narrowing of blood vessels, denying the vessel the nutrients, the oxygen, and the blood that it needs to survive.
And how does that differ from a hemorrhagic stroke?
Well, hemorrhagic strokes are caused by a vessel bursting within your brain.
So that day in October when you were getting ready for going to the store to go to work, you had a blood vessel actually burst.
Exactly. And I actually think that it happened days prior. Now, I could be wrong. We never really
Is that a guess?
got a proper answer. That's a guess because 3 nights before I was out to dinner and I felt all of a sudden I just felt terrible. I felt disoriented. I felt weak inside, and I was sitting at dinner in a restaurant, and we left. My wife drove home because I didn't feel like driving, and 3 days later, on the 9th of October, is when I got up, and then I started to show the symptoms of the stroke.
So you think you actually had the stroke before you needed 911, right?
I may have started to bleed at that point in time.
Okay.
That may have been what I originally felt.
Okay. So let's talk about the treatments for these. Let's stay with ischemic. What are the treatments for ischemic stroke?
Well,
and what is the prognosis?
Number one, when you get to an ER, which once you realize the symptoms are, you dial 911, you get to an ER, they will use whatever imagery they have to, CAT scan, whatever particular imagery they use or wanted to use to establish whether you had a hemorrhagic or a ischemic stroke. If it's found to be an ischemic stroke, they will then introduce, I'm going to use the term agent, but they will introduce a medicine called TPA, tissue plasminogen activator. That's called it's a clot buster.
It's a super duper blood thinner, isn't it?
It's basically supposed to break up the clot.
But it is, right? Isn't it thinning the blood?
Well, it does, but the point is that you can't wait that long. You're not supposed to wait that long for that blood to thin out. Years ago, they may have done this. This TPA was only introduced in 1996, just 25 years ago. I just wonder what happened to all the people prior to that, how they were diagnosed and how they were handled. But it's supposed to break up the clot. In most instances, it will do so. If not, there is also a very brand new, innovative system that's called mechanical thrombectomy. Thrombectomy. That won't be on the test because I can't even say it right. That is where the doctor, the surgeon, will insert a catheter in the groin. And with special innovative X-ray machinery, they'll be able to follow that catheter through the vessels until they get to the clot. Then a stent...
All the way up in your brain.
All the way up in your brain. And then a stent retriever will be released. And what it does is it encompasses the clot by itself, completely encompasses the clot, and the surgeon will then remove the clot going backwards through the same path that it adhered to prior, and pull the clot out.
So essentially grabbing it and pulling it back out the way they would aim it.
Exactly.
So okay, so that's the treatment for ischemic stroke. Can you speak a little bit about the prognosis for people? I mean, obviously, majority of them.
Well, number one, time.
They survive, right?
Most of them will survive. Well, yes, but there are about 800,000 strokes a year, and I think the number is 167,000 will pass away. So not everybody is lucky enough to survive these particular strokes. The most important thing to remember is getting to the hospital on time, recognizing the symptom, calling up, getting in. Right now, I think it's about 4.5 hours. They recommend that if you're in there within 4.5 hours, they should be able to treat you properly. With this thrombectomy situation now, that's up to 6 hours or more. In some instances, some people up to 24 hours have had that clot removed. Those are few rare occasions. I could be told completely wrong. That may have changed in the last 2 or 3 years. But by and large, that's basically what it is. You've got to be there within 4.5 hours.
And what about hemorrhagic stroke? What's the treatment for that?
Well,
the kind of stroke you had, actually.
The funny thing is, as lethal as they may be, I could spend only a few minute and a half, 2 minutes discussing the treatment for a hemorrhagic stroke. Number one, you constantly have to monitor the patient's blood pressure. You've got to find exactly where the bleed is. Whether or not the bleed will subside at some point in time. And then if it doesn't, there's a possibility that neurosurgery to repair the vessel that has burst may be the last step on the agenda.
How do they, short of going in there and closing the hemorrhage, how do they stop it without going inside of you?
Well, you know what? Maybe I'm not I haven't found myself as well versed in that area as I should be. I was told that.
But it happened to you, and they did not operate on your brain.
They did not operate on me. No, that the bleeding subsided. Maybe it was in a very small vessel inside my brain. I'm not going to. I want to.
So it healed on its own.
Healed on its own, basically. Exactly, it had to. I had a number of CAT scans, procedures afterwards to make sure the bleeding, didn't start again, didn't disrupt my normal system. And again, neurosurgery is I suppose the last stop that they would possibly take.
And what about TIA? What are they doing? What do you do for?
Well,
how is that treated?
TIAs will happen the same way as I had mine, or anybody else will have theirs. Unfortunately, what will happen is you may get up in the morning, you'll be going to bed at night, you may be maybe afternoon having dinner, and the symptoms that one would realize, the eye problems, the balance, your facials, anything could happen that would lead you to believe that you're having a stroke. Of course, the first thing you want to do is call 911. Don't be your own procrastinator. That's not the right word.
Yeah, I get it.
Yeah, but I think you have an idea what I'm talking about. Get to the hospital, get examined. As I said, sometimes 5 minutes after you first have the symptoms, these things will pass. There may be something that broke off from a clot. There may be some cholesterol within that causes this, but it will disappear all by itself all of a sudden, sometimes up to 24 hours from what I understand. But the one thing that one should remember is if you have a TIA or mini stroke, as people want to call it, you're much more likely to have a full-blown stroke down the road. What this means is that you've got to call your primary doctor, and you've got to have tests done. You've got to have blood work done. Maybe you do have a large cholesterol problem. Maybe there is diabetes. Maybe there's something in the back of your medical history that can dictate the fact that this is why it happened. And if you're not careful, it'll happen again.
So we'll be, in other videos that we have planned, we'll be addressing, so check out the channel to find them, but we'll be addressing what you do immediately following a stroke, in the moments that follow a stroke. We'll be covering that in separate videos. It's just too big a topic to cover in this conversation. So in this one, we just wanted to talk about the kinds of stroke and how they're treated and what's causing them.
And what's causing them, in no particular order, number one is hypertension, high blood pressure. That's number one. Cholesterol, diabetes, atrial fibrillation. That's a long word, and as many commercials as you've seen for atrial fibrillation, which is basically the upper chambers of the heart, the atria, there'll be a different heartbeat.
An unwanted electrical impulse.
Yeah, electrical impulse, a rhythm change. And what happens is then the atria on the top, the blood will start to pool. It doesn't rotate through your heart.
It'll puddle, it'll gather.
It'll start to puddle and gather. And then eventually sometimes clots will be thrown out.
Yeah, blood needs to move. If blood is puddling and gathering up, it can obviously start to coagulate. So that's why AFib is dangerous and strongly correlated with stroke. It can also cause a pulmonary embolism as well, because now the potential for a clot has increased dramatically because there's blood gathering and not moving out of your heart as it's supposed to.
Along with use of overuse of drugs, overuse of alcohol, and the one I just can't keep on reiterating enough, because I was 260 pounds in a 5.5 foot frame when I had my stroke, and I'm still overweight, but like 80 pounds less, is obesity. That is very, very important, because a lot of the other factors that lead up to stroke all are culminating from obesity to begin with. And that's my story. That's
cool. That's good. Good one. This is a good one. Please like and subscribe if you want to keep in touch with my dad and his videos. And thanks so much for tuning in. We'll see you soon.
And thanks for the manufacturers of Colace.
We're getting another plug there. Take care, everyone.
Good night. Good day.